Have you ever wondered what happens during a root canal procedure? This common dental procedure might seem intimidating, but understanding what goes on can help alleviate any apprehension. In the first step, the dentist conducts an initial examination. This involves a detailed inspection of the affected tooth, often using X-rays to determine the extent of the damage and to plan the treatment accordingly. It's like a reconnaissance mission, surveying the landscape before the main operation begins. Following the examination, local anesthesia is administered to numb the tooth and the surrounding area. This ensures that the procedure is painless. Think of it as a shield, guarding you against discomfort during the procedure. Once the area is numb, the dentist moves on to the isolation phase. This is where a rubber dam is placed around the tooth to keep it dry and free of saliva. It's like setting up a sterile field in a surgical operation, keeping the area clean and ready for the next steps. With the tooth well protected, the dentist then creates a small opening in the crown of the tooth to access the pulp chamber and root canals. This step, known as the access opening, is the gateway to the heart of the problem. Now that a path has been cleared, the dentist can proceed to remove the infected or damaged pulp tissue from the pulp chamber and root canals. This is done using specialized instruments, much like a skilled artisan carving out unwanted material from a precious artifact. Next comes the cleaning and shaping phase. The root canals are thoroughly cleaned, shaped, and disinfected to remove any remaining bacteria and debris. It's a meticulous process, ensuring that the root canals are pristine and ready for the next step. The cleaned root canals are then filled with a biocompatible material called gutta percha. This helps to seal them and prevent reinfection. It's akin to fortifying a castle, ensuring that no invaders can breach the walls. Once the root canals are filled, a temporary or permanent filling is placed in the access opening to seal the tooth. This is the restoration step, ensuring that the tooth is well protected as it heals. In some cases, a follow-up appointment is scheduled to assess the healing process and determine if further treatment, such as a dental crown, is needed to protect and strengthen the tooth. Think of it as a quality control check, ensuring that everything is on track and functioning as it should. Throughout the procedure, the dentist takes every precaution to ensure the patient's comfort and safety. After the root canal, the tooth should be free of pain and restored to function with proper care and maintenance. In essence, a root canal procedure is a journey from initial examination to follow-up. It is a meticulous process aimed at relieving pain and restoring the health of your tooth. So the next time you hear the words root canal, you'll know exactly what journey your tooth is about to embark on.